As a psychologist, I often encounter patients who struggle with various emotional and physical challenges. One condition that frequently comes up is premenstrual dysphoric disorder, or PMDD for short. This condition can significantly impact a woman's life, but understanding its symptoms and knowing the strategies that can help manage it can make a world of difference. Today, I want to share insights on PMDD, its symptoms, and effective strategies based on the latest research. Welcome back to Savvy Psychologist. I'm your host, Dr. Monica Johnson. Every week on this show, I'll help you face life's challenges with evidence-based approaches, a sympathetic ear, and zero judgment. So the first thing on your mind is probably, what is premenstrual dysphoric disorder, or PMDD? PMDD is basically a severe form of PMS that affects about 3 to 8% of women of reproductive age. Unlike PMS, which can cause mild to moderate symptoms, PMDD is characterized by intense emotional and physical symptoms that can interfere with daily activities and relationships. These symptoms typically occur during the luteal phase of the menstrual cycle, which is the time between ovulation and the start of menstruation, and subside once menstruation begins. The symptoms of PMDD are both emotional and physical. They can vary from person to person, but often include emotional symptoms. One category can be severe mood swings, so sudden feelings of sadness, hopelessness, or extreme irritability. Another category might be depression, so intense feelings of sadness and despair. People often report anxiety or a heightened feeling of tension or nervousness, and also anger and irritability. And this can look like increased conflicts with others or feeling out of control. And then lastly, difficulty concentrating, so trouble focusing on tasks and making decisions. There can also be physical symptoms to PMDD. The first one I'll mention is fatigue. So this is where you feel unusually tired or lacking in energy. Sleep disturbances. So this can be difficulty sleeping or sleeping too much. Other symptoms that people might report might be things like bloating, breast tenderness, headaches, and also joint and muscle pain. While the exact cause of PMDD is not fully understood, it's believed to be related to hormonal changes during the menstrual cycle. So fluctuations in estrogen and progesterone can affect neurotransmitters in the brain, such as serotonin, which play a crucial role in mood regulation. Women with PMDD may be more sensitive to these hormonal changes, leading to more severe symptoms. Managing PMDD often requires a multifaceted approach. So here are some evidence-based strategies that can help. The first thing I want to talk about is various lifestyle modifications. The first being regular exercise. So engaging in regular physical activity can help reduce stress, improve mood, and alleviate physical symptoms. So you want to aim for at least 30 minutes of moderate exercise, such as walking, swimming, or yoga most days of the week. You also want to look at having a healthy diet. So eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help stabilize blood sugar levels and improve overall well-being. Also, avoiding caffeine, alcohol, and sugar can help to reduce symptoms. Some research studies also suggest that calcium, vitamin B6, magnesium, and omega-3 and omega-6 supplements can be helpful. If you think your diet may be affecting your PMDD, consider seeing a nutritionist or dietitian for more guidance on how to adjust your eating habits. The next thing I'll mention is adequate sleep. So prioritizing good sleep hygiene is crucial. You want to aim for 7 to 9 hours of quality sleep each and every night. Establish a regular sleep schedule, create a relaxing bedtime routine, and ensure that your sleep environment is comfortable for you. The next category I want to talk about is stress management. And the first thing I'm going to mention is mindfulness and meditation. So, practicing mindfulness and meditation can help reduce anxiety and improve emotional resilience. Techniques such as deep breathing exercises, progressive muscle relaxation, and guided imagery can be beneficial. You may also want to consider therapy or counseling. So, cognitive behavioral therapy or CBT is particularly effective in managing the mood related symptoms of PMDD. CBT helps identify and change negative thought patterns and behaviors, providing healthier ways to cope with emotional challenges. The next category I'm going to mention is medications. Selective serotonin reuptake inhibitors, or SSRIs, are often prescribed to help manage mood symptoms of PMDD. Common SSRIs may include fluoxetine, sertraline, and citalopram. I also want to mention hormonal treatments. Birth control pills can help stabilize hormone levels and reduce symptoms for many people. Understanding PMDD and recognizing its symptoms is the first step towards managing this challenging condition. By implementing a combination of lifestyle changes, stress management techniques, nutritional supplements, and if necessary, medications, women with PMDD can find relief and improve their quality of life. If you suspect you have PMDD, I encourage you to speak with your healthcare provider to develop a personalized treatment plan. Remember, help is available, and with the right strategies, you can take control of your health and well-being. If you have a mental health question you'd like for me to cover, let me know. You can contact me via Instagram at KindMindPsych or via my email at psychologist@quickanddirtytips.com. The Savvy Psychologist is a Quick and Dirty Tips podcast. It's audio engineered by Steve Rickyberg, with script editing by Brandon Getchus. Our podcast and advertising operations specialist is Morgan Christensen. Our digital operations specialist is Holly Hutchings. And our marketing and publicity associate is Davina Tomlin. Follow Savvy Psychologist on Apple Podcasts, Spotify, or wherever you listen to podcasts. That's all for this episode of Savvy Psychologist. Thanks for listening, and I'll see you next week.